I wish to ask the Minister for Health and Social Care how many patients are being treated by the Child and Adolescent Mental Health Service, CAMHS, and how many patients in the past 12 months who attended an initial appointment at CAMHS were assessed as not meeting the threshold for CAMHS treatment.
Call on the Minister to reply. Mr Ashford.
Thank you, Mr President. On the 6th of June 2018, there were 822 patients under the age of 18 being treated by CAMHS. The cases of children and young people who were referred to CAMHS are reviewed on a weekly basis by a panel. The number of referrals which were reviewed and assessed as not meeting eligibility criteria between the 1st of April 2017 and 31st of March 2018 was 87. Due to the review process, it is rare for patients to be assessed and not meet the criteria. At present, because of the length of time for assessments, which is approximately 16 weeks, CAMHS may find that on occasion some patients are no longer in need of support when they are assessed because the situation has either improved or been resolved.
Supplementary, Mrs Caine.
Thank you, Mr President. The Minister's figures are very shocking, I think. He's already revealed there were 152 young people, I believe, on the waiting list. Do we have a crisis in mental health care for young people on the island at the moment?
Minister to reply.
Thank you, Mr President. I think we need to put some context around this because, unfortunately, when we do mention things like children and adolescent mental health, obviously the first thing that springs to mind is the worst case scenarios. So I think we do need to look at what the service is providing for. So you do have those worst case scenarios where you could be dealing with children that have had psychotic episodes, have suicidal intent, self-harm, but also included within that process is you do have other priority risks as well, such as stress, bereavement within that service and behavioural problems. So it is a wide range that we're looking at. So we can't turn around and say that all the children, 822, are at the high end. I think what is important is we treat each of those children as an individual, Mr President, within the service, that we don't try and box them off and try and say they've got this one particular problem, because what you tend to find as well is that there's multiplying underlying factors with children. So it's not necessarily just one thing that's affecting them, it can be 2, 3 or 4. And so treatment in some cases can take quite a while, and it is a complex case of treatment, so it's not something that's fixed easily. I don't believe we're suffering at the moment a crisis in children's mental health, but I do think obviously we need to watch the figures and we do need to make sure that those children who do require support get the support that they need.
Supplementary, Mrs Caine.
Thank the Minister for his comments. Would you agree that perhaps when there are so many young people awaiting assessment as well as undergoing treatment through CAMHS, that perhaps early intervention or increased early intervention could prevent more cases being escalated to CAMHS? And is he content that there is enough commissioning at a lower level to reduce the pressure on the mental health service for young people?
Minister.
Thank you, Mr President. Early intervention is something that, as I think I've said before in this honourable court and another place, very, very important. For me, early intervention is the key to a lot of things within the health and social care remit. I know that is a view shared by my senior management team as well, including the Director of the Mental Health Service. We have seen year-on-year referrals increase into CAMHS. As I say, Mr President, that can be for various things, including behavioural issues as well. So last year, 2017-18, we saw 595 referrals in, whereas the year before we'd only seen 464. So it has been a rising trend. But I think also one of the things is we've got better at identifying people who are in need, and so that has led to an increase in referrals too. But as I say, the key for me is that there is not only just early intervention, but that when there is support needed, that we find the best support package for the individual child, that we treat them as an individual and look at what they need to actually help with their own individual mental health issue.
Honourable Member for Ramsey, Dr Adolescent.
Thank you, Mr President. Could the Minister confirm that when referrals are made to CAMHS, they are triaged in terms of importance, so that those children, young people and their families who are in an episode of crisis and need early intervention and urgent treatment are seen accordingly and don't have to wait the 16 weeks that he quotes.
Minister.
Thank you, Mr. President. I'm more than happy to confirm that. For instance, in the answer I previously gave before to one of the supplementaries, I mentioned about the varying different conditions that can present itself to CAMHS. So, for instance, where you've got a child suffering from a psychotic episode, suicidal intent, self-harm, obviously when that's triaged, that is going to be classed in a higher bracket than children who necessarily have presented with certain behavioural problems. So each case is looked at on an individual basis as to what the risk is, whether it's prioritised as high, medium or low, and then assessments and intervention are undertaken accordingly.
Supplementary, Mrs. Caine.
Thank you, Mr. President. Can I ask the Minister if the CAMHS service is based and uses facilities at the Braddon Hub? Because my understanding is that actually facilities previously based at Braddon Hub for children with complex care requirements have been turned over into more clinical space and for doctors. And actually, take one case, a teenager with complex learning difficulties, profoundly autistic, non-verbal and in nappies, for years supported at the Braddon Resource Centre, which I'm told was an amazing facility, but that was used to provide respite care for young people who are now having to travel to Ramsey. But I'm being told that because of the clinical facilities being used at Braddon Hub, there are no facilities for these children with severe complex medical needs.
Reply, sir.
Thank you, Mr. President. Obviously, I haven't got that information in front of me, but I will look into it for the Honourable Member, and if she contacts me privately with that individual case, I will have that looked into as well.